So, what is heart disease? Heart disease is a general umbrella term for a variety of conditions that affect the heart and blood vessels. It includes quite a few heart conditions, and it's a chronic disease that can lead to heart attack and even death. So, here's how I found out I had heart disease. This is kind of an interesting story. As part of my training to become a peer support leader, we had a cardiologist come in and talk about hearts. And after a few hours of hearing heart disease over and over, I just turned to the woman next to me and I said, I think I have heart disease. I have heart disease. And she looked at me the same way and said, I think I have it too. And we laughed. We both had different heart issues, but for some reason, we never even considered that we both actually had heart disease and that we'd be ticking off the heart disease part of any health questionnaire for the rest of our lives. It was an amusing discovery. So overall, male and female hearts look the same. And most doctors and medical schools were taught that all hearts are the same. It's just a muscle. But our hearts are smaller. We're about 2/3 the size. Our hearts tend to beat faster. Our coronary arteries are smaller. And importantly, there are differences in the way plaque builds up in our blood vessels and causes coronary heart disease. And our hearts are affected by hormonal changes, such as those experienced during pregnancy and menopause. The impact of heart disease on women has traditionally been underappreciated. So, heart disease is the #1 killer of women worldwide, accounting for 1 in 3 deaths. Every 20 minutes, a woman in Canada dies from heart disease. And heart disease is the leading cause of premature death for women in Canada. So, if you were to ask most women what their biggest health threat is, they're probably going to say breast cancer. But the reality is 3 times as many women die from heart disease than breast cancer. And heart disease rates are increasing in younger women aged 55 years and under, mostly due to a variety of risk factors and poor health behaviors. And 1/3 of women with heart disease referred to their condition as, an event or an incident. And then they just resumed their whole pre-diagnosis lifestyle. And this is a problem because heart disease is a lifelong condition that requires ongoing management. So, all of these facts that have been given to you, were you surprised by any of them? I know that when I was learning, I certainly was shocked at some of the facts about the differences between women's and men's hearts because I had known nothing going into all of this. I just thought hearts were hearts. So, all of these facts just make it why I believe it's so important to start the conversation and share what you're learning today with other women. So when it comes to heart disease, women are understudied and under-researched, even though women make up over half the population. 70% of heart disease clinical research focuses on men. And this is a problem because clinical research leads to clinical guidelines. And this is what the medical doctors are learning. We're underdiagnosed. Early heart attack signs are missed in 78% of women. That's huge, 78% of women. And we're undertreated. The lack of professional and public awareness of how women present with heart issues differently than men is contributing to adverse coronary outcomes for women. We're under-supported and under-aware. 50% of women don't attend cardiac rehab, even though it's been shown to improve patient outcomes. And most women don't know that 65% of heart patients will have situational depression, which is typically temporary and quite treatable. But let me tell you, it can certainly mess with your recovery. And depression is an important risk factor for adverse outcomes for cardiac survivors. So coming back to women being underdiagnosed, with early warning signs being missed in 78% of women, here are the symptoms most frequently reported by women. Now, not everyone's symptoms are going to be the same, and women are more likely to exhibit a combination of symptoms, usually 3, and are more likely to report signs and symptoms such as nausea, sudden fatigue, or shortness of breath. I know in my groups, I had a woman who said, I went down to get the laundry and I'd been doing some the day before, and this time I picked it up and I got about halfway up the stairs. I was suddenly so tired, my legs went rubbery, and I was just huffing and couldn't catch my breath. And I was like, this is really weird. I guess I am getting old. And as soon as I was able to, I just picked up the laundry and carried on. So it's important to know that even though men and women can both experience symptoms such as chest pain, the language that women use to describe their pain may be different, and that can definitely impact their diagnosis and their treatment to their detriment. Now, women don't always perceive symptoms of pain as severe. For example, chest pain or discomfort is often instead described as, oh, it's pressure, I have tightness, it's kind of squeezing, it's sore, it's kind of burning. And if their pain is less severe, or if they can even have non-pain signs such as nausea, the whole sudden fatigue and shortness of breath, which are signs more often reported just by women, they're more likely to delay going to emergency care. And they're less likely to be seen quickly when they do go to emergency care. So, speaking of emergency care, I recently read an ER nurse response to an article on why women don't get recognized at emergency the same as men for heart attacks. And she said it frustrated her that so many women downplay their pain and their symptoms. And it really frustrated her that doctors trivialized women's pain and symptoms and too quickly sent them home with the whole come back if it gets worse, versus men who would come in saying their chest hurts or it hurt earlier in the morning and it's still a little sore, and we'll keep you overnight just in case. Her advice was that women need to lead with the pain and then give their other symptoms and don't downplay them. And there's so many stories that I've read about and directly heard from women who have been turned away from the ER, turned away from their doctor, and then return in an ambulance afterwards. But now they have heart damage. So you know your body the best. Women can also present with other symptoms, and these symptoms are not usually associated with heart attacks, but they are with women. And today, ER physicians are far more aware of these differences, but still women, particularly younger women, may have their signs attributed to anxiety or heartburn or other female issues. And so they're less likely to get fast, aggressive treatment. And oh my gosh, female issues, oh, that's such a favorite one of mine. Menopause, so many symptoms to choose from. Upper abdomen pain, oh, gallbladder, that happens a lot when in menopause. Abnormal excessive sweating, yeah, some women just have hot flashes really, really badly. back, shoulder, arm pain. Yeah, getting old, all those hormonal changes, grab an Advil or Tylenol. Palpitations. Oh, my heart has just been beating really faster. It kind of feels like it's stopping and starting. It's really uncomfortable. Yeah, hormones will do that to you. Nausea. Yeah, that's that whole IBS thing, and it's tough. It's tough. Menopause is tough. Trouble sleeping. Yeah, those hot flashes and the anxiety and you're just waking up. Menopause is pretty tough. I mean, seriously, not everything is about menopause. And yet that's what it's attributed to. Oh, and then there's jaw pain. And jaw pain, oh, isn't that interesting? Jaw pain radiating up your neck and into your jaw, and you could hardly open your mouth. Well, that's interesting. No idea. It's not as painful. It's just aching now, is it? Okay, well, give us a call if it gets any worse. So there you go. Everything to just next patient, please, and get you out the door. So can you relate to any of these symptoms? And was there a symptom that you had before your heart event that you didn't even recognize was a woman's heart symptom? So this is why it's so important to be talking to other women about what we've learned and what we know. And it's really important if women are experiencing any of these to take notes, start a journal, a book, anything, a piece of paper. Figure, what was the date? What time did this happen? What were you doing? What had you just done? How painful was it? How long did it last? And keep a journal of this, because in showing a doctor, it just might trigger something with him to say, I think we need to explore this more.